Hello, everyone, and welcome to today's Better Hearing webinar. Our topic for today is on recent updates in hearing aid technology. I'm Caitlyn Whitson. I'm an audiologist at the UNC Hearing and Communication Center in Chapel Hill, North Carolina. I'm joined today by Nicole Oldrati. She is our newest fourth-year doctoral extern, and she will be with us until she graduates next May. She's coming to us from East Carolina University, so just down the road from us, really. She's originally from Garnet Valley, Pennsylvania, and moved to Virginia, where she got both of her bachelor's degrees. As a fun fact, Nicole worked as an audiology assistant before she started graduate school at East Carolina University, so she has been in the field of audiology for quite a number of years now. And when she's not working with us at the HCC, she enjoys traveling, hiking with her dog, and spending time with family and friends. So if you see her around in the clinic, which you probably will if you see us in the next year, you can say hello. So I'm going to now turn the talk over to Nicole, and she's going to get us started for today.
All right. Hi, everyone. For anyone who is new here, I want to give a little bit of background on our clinic. The UNC Hearing and Communication Center is a nonprofit practice of faculty doctors of audiology, and it's a training clinic for doctoral students of audiology like myself. We work with adult diagnostics, hearing aids, and hearing protection, as well as vestibular or balance and tinnitus specialty testing. We work with all hearing aid manufacturers and are an unbundled or fee-for-service business model. There are 3 locations you can be seen at. The picture below is a picture of our main clinic in Chapel Hill, but there are 2 others in the area that you can be seen at as well. If you'd like to make an appointment for any of those locations, you can use the number or email at the bottom and contact our main clinic to make those appointments. If you're watching this live, I will encourage you to go to our Facebook page and find our YouTube channel there. The URL is quite long, so it's easier to use Facebook to go through it. And if you are watching this on YouTube, I encourage you to subscribe to our channel. We have multiple different webinars on our channel that you can go ahead and watch through that. Like Dr. Whitson said, we're going to go through updates in hearing technology today. So here's a small layout of how and what we are going to talk about today. All right, I first want to review the auditory pathway, or how sound gets to the brain, before we start our discussion with hearing aid technology. So sound travels from the outer ear or ear canal, and it vibrates the eardrum and the 3 small bones in the middle ear, and then sends the sound to the cochlea, or our inner ear. The sound is then sent to the brain through our auditory nerve. A breakdown in any part of this pathway will cause a hearing loss. And the type of hearing loss is determined by where the impairment is, or where that breakdown is. If it's in the outer or middle ear, it's considered a conductive hearing loss. And if it's in the cochlea or inner ear, it's considered a sensory neural hearing loss. The type of hearing loss you have will influence how you're treated and what recommendations are given to you. Today, we're going to focus on sensory neural hearing loss. So a very common type of sensory neural hearing loss is presbycusis, or age-related hearing loss. This type of hearing loss is progressive and permanent, but it's very gradual, and it affects your high frequencies or high pitches first. With presbycusis, you have difficulty hearing soft everyday sounds and struggle in background noise or complex environments. There is a lack of clarity in speech understanding with someone who has presbycusis, sensory neural hearing loss. The configuration of presbycusis, or age-related hearing loss, will disproportionately impact your consonants. So the graph on the right is an example of an audiogram with someone who has presbycusis. On the left side of the audiogram are low bass tones, and on the right side are high treble tones or high pitches. The top of the graph is very soft sounds, and they increase in volume as you go down the graph. The thick black line that you see is an example of someone's hearing loss, where they have better hearing in the low bass tones and a more severe hearing loss in those high treble tones. With someone who has more difficulty in those high pitches, you start to lose speech discrimination with those high-pitched, soft consonant sounds. F, S, SH, and TH are the most common consonants that you lose when you have a presbycusis or high-pitch loss. A lot of our patients say, I can hear, but I just can't quite understand, because the clarity with those speech discrimination consonants are in some way damaged in some way. All right, so we've talked about hearing loss. So now let's talk about what to do to treat hearing loss. You'll need diagnostic testing. And before you are recommended hearing aids, wherever you go, you should have a comprehensive audiological and functional evaluation. And all of that should be included. Everything listed below should be included before your recommended hearing aids. Our clinic will go through every part of this audiological and functional evaluation before we recommend hearing aids. And I encourage you, wherever you go, to make sure that you're getting a full evaluation before they recommend hearing aids. With sensoryangan or hearing loss, there are two main treatment options. You can have a hearing aid, which is someone who has a mild to profound hearing loss, but whose speech discrimination is good when volume is loud enough. You'll receive benefit from a hearing aid or amplified sound. Someone who has a cochlear implant candidacy has a more severe hearing loss, and it does not matter how loud the sound is, their speech discrimination is still very poor. When that happens, they're no longer candidates for hearing aids. They no longer get benefit from amplification, and that's why they become cochlear implant candidates. Since we're focusing on updates in hearing aid technology, we're going to focus on hearing aids today. If you're interested in learning more about cochlear implants, there is another webinar on our YouTube channel that discusses a little bit more in depth of cochlear implants. So I encourage you to look there if you want some more information. So when you need to select a hearing aid, what do you do? A hearing aid should be able to provide appropriate amplification for all day. You should be able to hear and be comfortable in your hearing aids all day long, and they should be easy to put in and stay in. We want to make sure that the hearing aid fit for you is fit for your lifestyle and your hearing loss as well. Does that mean you need rechargeable hearing aids or hearing aids that have Bluetooth capability? Or maybe you need a hearing aid that has the possibility of getting an adaptive feature or an assistive device. All of that gets taken into consideration when we have a consultation with our patients. We want to make sure that we're fitting a hearing aid that matches your lifestyle as well as your hearing loss. And we want to make sure your communication needs are met with the hearing aids as well as with our follow-up appointments. Your audiologist is there to help you find the best hearing aid for you and your lifestyle. And those follow-up visits are important to make sure that you're getting the benefit and the appropriate care that you need. So let's talk a little bit about hearing aids. You can buy hearing aids from multiple places. The first place is the doctor of audiology. like this clinic has. Doctors of audiology are medical providers, and they're approved to see adults, children, and people with special needs. You can find a doctor of audiology in a university clinic, a private practice, a hospital, and an ENT setting. You can also get hearing aids from hearing aid dealers or hearing instrument specialists. These individuals have a high school diploma and a one-year apprenticeship, and they're most likely seen in retail hearing aid stores like Audeo or Costco. These individuals are only approved to fit hearing aids on adults. And of course, you can always buy your hearing aid online, direct to consumer, or over the counter. We will have another webinar on over-the-counter devices, and we will go into more depth on that. Some important facts that you should know about hearing aids. Hearing aids are an important tool for improving communication. Hearing aids are not the end-all be-all. They will not cure your hearing loss, but they should be provided as a context for rehabilitation. In addition to your hearing loss, we're going to give you hearing aids to help you rehab and treat the hearing loss. We can't cure it. Any auditory processing difficulties that you had previously will still remain with the hearing aids, because all sound is being presented to your sensory organ, which has some damage to it because you have a hearing loss. Hearing aids themselves are computers. They have to be programmed by a provider to make sure they're programmed correctly and appropriately for your loss. You can get a hearing aid anywhere. What's more important is where you're going to get the hearing aid and who's fitting the hearing aid. The big bold letters at the bottom, the provider matters more than the product. How your hearing aid is programmed by your provider is the most important part. You can buy a hearing aid anywhere, but if they aren't fit appropriately for your specific loss, it's not going to do, everything that it can do. So once you get a hearing aid, how do we verify that it's appropriately fit for you? We use something called real ear verification, and the man in the picture below is going through a process of verification. He has a small microphone in his ear and the hearing aid on top, and we are looking at what the hearing aid is sending into his ear. The printout on the left-hand side of the screen shows the screen of the verification system. On the left-hand side is low bass tones, and on the right-hand side are high-pitched treble tones. We have very soft sounds at the bottom of the graph, and they increase in volume as you go up. The blue line is his hearing loss. And then you have the small cross marks or hash marks that are the prescriptive targets for his hearing loss. The orange line is the output of the hearing aid. And when hearing aids are fit appropriately, that orange line will cross through as many of those hash marks as they can. If you look at the screen, you can see that specifically where the circle is, that the line is not anywhere near the hash mark or cross prescriptive target. It's significantly below, which means that the hearing aid is not giving enough benefit for the patient. It's underfit. Here's an example of a hearing aid that is prescribed to targets. If you can see, all the lines are going through very close to the hash marks, which is exactly what we want to see. This shows that they're getting enough sound for their loss and they're not being over amplified or under amplified for their specific hearing loss. So we do this for every single patient who gets fit with hearing aids. And I encourage you, wherever you go, that you make sure your audiologist does real ear verification to make sure that you're getting the correct amount of output that you should to be able to hear everything that you should with your hearing loss. All right, and I'm going to hand it back over to Dr. Whitson to talk a little bit more about some new hearing aid features.
Thank you, Nicole, for that introduction about hearing loss and hearing aids. I think it's important to have a foundation of where you're at with hearing aids before you can talk about what's new, right? So we're going to start with talking about probably the most popular option that's come out in the last few years, and that's having rechargeable hearing aids. So all hearing aid manufacturers still have an option to have a disposable battery that gets changed every few days. Every manufacturer now typically has a rechargeable over-the-ear style hearing aid as an option as well. They come with lithium-ion batteries. Those batteries generally last about 2 to 4 years. The longevity of the battery depends on the manufacturer. Rechargeable hearing aids are really nice because they're convenient on the day-to-day, and they're really good for people who have vision and dexterity challenges. So if you can't see that a battery is in correctly or you have trouble feeling to open the battery door, rechargeable is a nice option instead. The day-to-day battery life varies by manufacturer. Some of them are around 18 to 20 hours. Others can last up to 36 hours on a single charge. As the hearing aid battery gets older, after a few years, the daily life does start to shorten, just like you probably know with your smartphone battery. After you have it for a few years, it does not last as long on a single charge. And that's true for all of the hearing aid manufacturers as well. There are a couple of different options when it comes to charging. Some of them, like Oticon's pictured here, are a dock that you plug in and you don't really move the charger. The hearing aids just sit in it. Other options are more portable, so one that you could unplug periodically and charge on the go with a lid, like pictured in all three of these pictures. Every manufacturer, as I mentioned, has an over-the-ear style rechargeable option, and there are 2 manufacturers who now have a custom in-the-ear style hearing aid that's rechargeable. Pictured there is Starkey's version of that, and Signia also has that as an option. They are considered ITE hearing aids or in the ear, but they're not really tiny in the ear hearing aids. They're pretty large, and that's because we need a decent sized surface area to be able to contact with the charger. So we don't have invisible in the ear hearing aids in rechargeable options yet, but I'm sure it's coming. Bluetooth is the next really popular option for recent features, and Bluetooth streaming has actually been out now for about 10 years. Resound was the first manufacturer to have iPhone streaming, but now every manufacturer has this as an option. With having a connection with Bluetooth, there are really 2 things that you can do. You can stream audio to the hearing aids like phone calls, your podcasts, your audiobooks, or music. And this gets the sound into both of your ears, and it's a direct sound signal. So it means that the call quality is a little bit clearer versus holding the phone up to just one ear, which anyone with hearing aids or hearing loss will tell you is challenging to talk on the phone when you're working with one ear. The other benefit of Bluetooth streaming is having control of the sound settings of your hearing aids, which not everyone wants. Some people want it to be hands off and they don't have to worry about making adjustments. Other people really like to be able to make a lot of adjustments. And so not all manufacturers' apps are created equally. Some of them are more simple. It's a volume control, or you can change some preset listening programs that your audiologist has put in. Some manufacturers, though, will let you make a lot of changes to what you're hearing with a sound equalizer or the ability to create your own custom programs within the app. Some manufacturers also offer a Find My Hearing Aid feature, which can be really useful if you're prone to losing your hearing aids, or if you're the caregiver for someone and they're prone to losing their hearing aids or setting them down. You could pair your phone app to their hearing aids to be able to find them later. A new feature, or new features really, that are coming out now are also hearable features, or smart or AI features. And we'll go more into depth with that in just a moment. Advanced sound classification is something that's been out for a long time in hearing aids, and it's just getting better and better as we go on. So if you've been in any kind of hearing aid appointment, you've probably heard us say, hearing aids are listening to the sounds around you and adjusting for you automatically. But what does that exactly mean? Well, it's taking in the sound and it's actually classifying it into a category or a sound class. And then based on what sound class it falls into, it's modifying the sound. And all hearing aid manufacturers have different tiers or levels for how advanced the computer chip in the hearing aid is. The top of the line hearing aids are the most advanced, and the lower basic tier hearing aids are not so advanced, but still pretty smart. But they have less sound classes compared to the top of the line. So what I mean by that is if you look at our different tiers here on the side, this is our top of the line hearing aid, and it will be able to categorize all these different classes of sound. So if you're, say, driving in the car, the hearing aid's going to detect, oh, you're in the car. We probably need to make things a little bit quieter because the car is noisy and there's a lot of road noise that happens. But if all of a sudden someone next to you starts talking, the hearing aid's going to detect, oh, there's speech coming from this direction. Let's focus on that speech, but also keep the car noise down so that the speech can be heard more easily. And so the hearing aid's going to make changes based on the sound class that those sounds are categorized into. On the other side of the spectrum, with a lower tier hearing aid, it's going to be less expensive, but it's not going to be as accurate with its classifications. So, for example, in this hearing aid model, it's going to take all sounds and categorize it into one of three categories. It's either music, it's quiet, or it's a party, which is kind of a background noise type environment. So if you're in the car driving down the road, the hearing aid is either going to classify that as music, quiet, or party. So, and that is going to be true if you go from the car into the grocery store. Grocery stores sounds are going to be categorized as music, quiet, or party. So it's less exact, if you will. As we go on in time, hearing aid classification is getting better and better. One of the new things to come out in 2021 that's going into that hearing aid classification are motion sensors placed into hearing aids. So the integration of motion sensors affects the microphone directionality. In other words, where the microphones are picking up sound around you. So traditionally, when hearing aids detect there's background noise, most of the time that's going to be in a restaurant situation. So most hearing aids in background noise will focus their microphones to the front and try to turn down sounds from behind and the sides. But let's say you're out on a walk outside and there's traffic going by and it's kind of noisy and you're talking to someone next to you. If you're walking forward and the hearing aid microphones detect, oh, there's noise, we need to focus in the front. It's not going to help you hear the person next to you. But with the motion sensors added in, now the hearing aid's going to detect, oh, you're walking. If there's speech, it's probably going to be coming from the sides. So rather than having a forward focus, we're going to have a side focus. We're going to listen for where the speech is coming from and focus in that direction. We call this adaptive directionality. So the motion sensor is currently available from 2 of the major hearing aid manufacturers, and it leads to more accurate sound classification in noisy environments for still versus moving. All new features tend to come out from 1 or 2 manufacturers first, and then the rest will usually release it within the next few years. So I expect this option to come up in future manufacturers to come. Water resistance is another big aspect of wearing hearing aids. Keeping hearing aids dry is incredibly important. If you were at my talk, I guess about 2 months ago, I introduced you all to our first waterproof hearing aid, and this was released by Phonak a few months ago. It's called the Audeo. P stands for Paradise Life, and Paradise is referring to their newest generation of computer chip. It's an over-the-ear style hearing aid that is rechargeable. It uses inductive charging, meaning it's a contactless charging. All hearing aids are tested for an IP68 rating, but this hearing aid was tested beyond the IP68 rating to determine that it is indeed waterproof to a certain depth. It's got special coating and silicone around all of the seals to help keep water out over time. One thing that should be noted, though, is that the earpieces or the receivers, which you see pictured here, these are not waterproof. Now, they go down in your ear, so if no water gets in your ear, fine. The body of the hearing aid is going to be waterproof, but this part is not. So still not really recommended to go swimming laps in a hearing aid. Not just for the fact that you might lose it in the pool unless it's attached with some sort of clip, but the receiver part could get wet and damaged. So I mentioned this IP68 rating, and one thing that all of the other manufacturers will tell you is that all hearing aids pretty much have an IP68 rating, at least from the 7 major hearing aid manufacturers. So what does that mean exactly? The IP stands for ingress protection, and it's a scale rating dust and water resistance, so keeping things from getting inside electronics. The first digit of that rating indicates resistance to dust particles, and 6 is the highest rating. The second digit indicates resistance to freshwater liquid. 9 is the highest rating. An 8 indicates a resistance to a depth of up to 1.5 meters for about 30 minutes. So pretty much all the major hearing aids will have this IP68 rating. So all of the manufacturers other than Phonak will tell you that this waterproof hearing aid doesn't really matter that much. But if you're aware of hearing aids and you sweat a lot, or you're exposed to moisture, or you live in a really humid environment like North Carolina in the summer, they'll tell you they would love to have a hearing aid that's waterproof. So I'm really happy to see Phonak come on the market with this hearing aid. And I think other manufacturers are going to release similar form factors to come. So I have a little piece about what kind of testing the hearing aid went through to be determined that it's waterproof. So they tested it in fresh water, salt water, and pool water in test chambers. They pressurized these test chambers to simulate a depth of centimeters at 122 degrees for 520 5-minute cycles. So between 5-minute cycles, they release the water, sat the hearing aid there in the humid environment for another 10 minutes, and then filled it back with water and pressurized it again. When they tested in seawater, 7 of the 10 hearing aids that they tested passed, meaning they turned on and they passed their test box measurements after 520 cycles. So even though it's only 10 hearing aids being tested, that's a lot of cycles to go through being in pressurized water. And 7 of the hearing aids made it through that and still were fully functional. One of the 3 hearing aids that failed that test after it was allowed to dry out actually started working again. And for pool water, 9 out of the 10 hearing aids passed, so for fresh water. And the one that did fail, they noted, failed on the very last cycle of exposure. So pretty promising testing, I think. So I'm excited to see what the future holds for water resistancy, because moisture is usually the biggest reason that a hearing aid goes in for repair. So I briefly mentioned Hearables earlier, so I want to take a moment to talk about this. You know, we have a cell phone in our pocket that is more than just a phone. It's the whole internet and calculator and everything you could imagine. And then we have smart watches on our wrists that do more than just a watch. They can track your steps, track your workouts. You can even control your hearing aids from them if you have a hearing aid app downloaded onto them. And so this smart technology is starting to bleed into the hearing aid market, if you will. And this is run through the smartphone apps for hearing aids. Now, not every manufacturer has these options. Some of them do. Starkey was one of the first to come out with some of these features, and Phonak is starting to release these as well. Some of the hearable features include a heart rate monitor that monitors your heart rate directly in your ear with a piece attached to the receiver. There's also a step or activity tracker. Starkey has a fall detection capability where if the hearing aid detects it's fallen over, if you don't tell your app that it's a false alarm within a few seconds, it's going to call a loved one or call 911. And if your hearing aid's connected to your phone, which it should be if it's detected the fall, when it calls someone, you're going to hear the call in your hearing aid while you're on the ground. So this is a really nice feature for people who live alone. Hearing aids now can do language translation. Starkey was one of the first people to have real-time translation integrated into their app that connects to the phone. And now with that, the iPhone has released a real-time translation app on their phone called Translate. Anyone with a Bluetooth capable hearing aid can access real-time language translation. You do need to be connected to the internet to use that feature. And Siri and Alexa are also integrated now into most hearing aids that have Bluetooth capabilities. So if you like to use Siri or Alexa to check the weather or ask what time it is or set a reminder, you can do that right from your hearing aid. So if you're interested in any of these features, not every manufacturer has them, as I mentioned. So when you have your next new hearing aid consultation, you want to discuss this with your audiologist, because it's one of those things that you want to find a hearing aid that checks all the boxes. So if having a fall detection is important to you, well, there's only one manufacturer that offers that right now. So a lot of these features can't be added in after the fact. Even if that company comes out with that feature, it's typically released in a different model entirely, and you can't just be installed with software. So in summary, our latest new hearing aid features include rechargeable hearing aids or with charging on the go with portable chargers, Bluetooth streaming, advanced sound classification that's getting better and better as we go, and having motion sensors in hearing aids is a great example about how much better sound classification is getting. Having waterproof hearing aids, being able to track your steps and heart rate, fall detection and fall alerts, calling a loved one if you have a fall, or emergency services. And remember that new features are being released every few years, though it typically takes a few years to work out the kinks, so to speak. So if a new feature comes out and it's really groundbreaking, sometimes you want to wait a couple years or even just a couple months to see how it's going to work out in the long run, because sometimes there are some bugs with new features. And when one manufacturer comes out with something, sometimes they rise above the rest for a couple months, and then the other manufacturers come out with similar features. So if it's not available in the brand you like yet, if you wait a little while, sometimes it does come out with the others. Every manufacturer has tons of features, different models of hearing aids, different styles, and it can be a lot to navigate. So an audiologist is here to help you navigate what you're looking for in a hearing aid and find the manufacturer that best matches with your listening and lifestyle needs. Remember that real ear verification is a foundational, necessary part of every hearing aid fitting. So you need to see a provider who uses real ear verification, because regardless of all of these special adaptive features and Bluetooth and rechargeability, if the hearing aid's not providing the right amount of amplification, you're not going to want to wear it. And remember that hearing aids are only one tool used to treat hearing loss. So they're just a piece of your communication needs. You will often be recommended communication strategies and possibly some assistive devices to supplement the hearing aids, because as Nicole mentioned earlier, hearing aids don't cure hearing loss, and we need to think of communication as a whole, not just putting on a hearing aid in order to treat your hearing loss.